Hey y'all, it's Dr. Lipin from Northside Plastic Surgery. Today we're going to talk a little bit about rejuvenation of the earlobes. So as we age, and also if you are someone who likes to wear heavy earrings, you may notice that your actual lobe of your ear has stretched with time, or perhaps the actual piercing has gotten stretched and stretched and stretched to the point where it's completely torn through, or to the point where it's just so stretched out that you can't keep your earrings in safely. So what options do we have to treat this? The first option we have is a surgical repair of the earlobe, and that is done in our office under local anesthesia, so it does not require any general anesthetic. We sterilize the area and then we use local anesthetic to make it more comfortable. The procedure is done in about 20 minutes, and we essentially excise some of the extra tissue and then use sutures to bring the tissue back together, making the earlobe smaller. And especially if this involves the piercing, it will temporarily close your piercing. We can re-pierce your ears 2 months after the surgery repair date. So that way your scar has enough time to get strong, so we can place the new ear piercing and it won't tear through. Another option is to actually use filler. And this is better for people who have a slightly stretched out ear piercing, opposed to the completely stretched out ear piercing. And in these cases, we can use a little bit of filler and we inject it around the piercing, and it will actually not only make the hole smaller so you can wear your earrings more comfortably, but it also provides a little bit of plumpness to your earlobe, but actually makes you look younger. Hope this was helpful.